Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 3 new cases of COVID-19 in Windsor and Essex County. 1 is a close contact of a confirmed case, and 2 are still being investigated. We have had 16,784 cases since the beginning of the pandemic. 63 people are active at this time, with 24 of our active cases being a variant of concern. To date, 1,942 preliminary or confirmed variants have been identified in Windsor-Essex County. 6 people are currently in the hospital and 5 people are in ICU. Our community has lost 434 people to COVID. There are currently 2 active outbreaks in Windsor-Essex County, 1 workplace outbreak and 1 community outbreak. Now for the vaccine update, 268,700 people have received at least 1 dose. Overall, 73.4% of adults 18 years and older in Windsor-Essex have received at least 1 dose of a COVID vaccine. 32.4% of our adults 18 years and older are fully vaccinated with 2 doses. Eligibility for second doses of an mRNA vaccine opened up this past Saturday. Those who received their first dose of an mRNA vaccine on or before May 9th are able to book for their second dose of an mRNA vaccine at a mass vaccination clinic, pharmacy, or primary care provider. In addition, we would like to inform our residents that with the exception of our youth 12 to 17 years of age, anyone who books a first dose or second dose of an mRNA vaccine will only be guaranteed an mRNA vaccine, which could be either Moderna or Pfizer. Based on the interchangeability of the vaccines in our current vaccine supply, we cannot guarantee a specific mRNA vaccine. This will impact our mass vaccination clinics beginning Wednesday, June 23rd. Locally, our shipment of Pfizer has been delayed, and as such, we are closely monitoring our supply and will be providing Moderna as the primary vaccine at upcoming clinics. We are no longer in a position to match vaccines for first and second doses. Residents can expect the following in our mass vaccination clinics across Windsor and Essex County. First doses for those 18 years of age and older will receive an mRNA vaccine, likely Moderna. First and second doses for those 12 to 17 years of age will be receiving an mRNA vaccine. It's Pfizer at this time, but that could change as we hear more about Moderna. Second doses for those who received a first dose of an mRNA vaccine will receive an mRNA vaccine as their second dose, and that will be either Moderna or Pfizer. Second doses for those who received their first dose of AstraZeneca 8 weeks ago will receive an mRNA vaccine, and that would be Moderna. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. We've been talking about COVID-19 vaccine mixing and matching for weeks now. We heard from the experts, we looked at the real-world data, we looked at the clinical trial data, and now given the supply challenges, we are not in the position to guarantee any specific brand of COVID-19 vaccine. Given the safety profile, the effectiveness of both these mRNA vaccine, residents will be offered any of the 2 mRNA vaccine at the vaccine clinic. And I want to reassure everyone that vaccine interchangeability recommendations are backed by the National Advisory Committee on Immunization, Public Health Agency of Canada, and Ontario Scientific Table, and many other experts in the field. They are all offered under the direction of the provincial government. Please make no mistakes that Windsor-Essex is doing well in the 3rd wave because of our residents who rolled up their sleeves to get the first vaccine that was available to them. All these early vaccine uptake really helped us to prevent the 3rd wave in our region. We are now at a critical junction to ensure that our residents are fully vaccinated with 2 doses of the vaccine. Delays in vaccination could result in ongoing COVID-19 transmission and can send our region back with high COVID-19 cases and COVID-19 outbreaks. Both these mRNA vaccines are equally safe and equally good in protecting you from the COVID-19 virus and do not put you at any disadvantage. Please do not hesitate to receive the mRNA vaccine that's available to you. Switching topic. As the province is opening up more and more, we need to make sure that we have all the public health measures in place to reduce the risk of transmission of COVID-19 in our community. In order to continue to progress through these reopenings safely, today I'm issuing a class action order. In fact, I'm updating my class action order and letter of instructions to intensify our local efforts to ensure public health measures are used appropriately with more clarity for the public. The order issued under the Health Protection and Promotion Act will further mandate employers to follow legislation, implement employee protection by following COVID-19 public health measures, and cooperate with the outbreak investigation. The order additionally enables the Windsor-Essex County Health Unit to dismiss a team or shift, implement a partial closure of the workplace or a full workplace closure to manage the workplace outbreak and mitigate further COVID-19 transmission. Closures due to an outbreak will be applied in a balanced approach with regards to the health, safety, and the best interest of the public. Please note that this order and the letter of instructions is not new, but it further clarifies the expectation that already exists under the legislation and is not meant to cause any undue hardship to any local businesses. In fact, it helps to clarify and set the expectations straight. The order will be applicable to all owners, operators, and employees, including contract workers and those hired under third-party agencies, volunteers, and students of a business organizations or workplaces in Windsor-Essex County. Some of the key highlights of the order and the letter of instruction include: Number one, ensure that Windsor-Essex County Health Unit is notified when 2 or more persons who tested positive for COVID-19 with a 14-day interval at your workplace by calling to our health unit immediately to help us determine if there's any outbreak or if there's ongoing transmission happening at the facility. It is in the best interest of the employer as well as it's in the best interest of the public. Number two, workplace closures are based on the evidence of workplace transmission, which will be determined after a careful investigation and thorough review of all the cases and their potential acquisition sources and the public health measures that are currently in place at these workplaces. Closures will be implemented where 5 or more employees likely acquired COVID-19 within a 2-week or 14 days time frame, and the extent of a workplace closure will depend on the level of the spread within the workplace and the measures or interventions required to be applied to control the outbreak. Workers impacted in a workplace closure must isolate for 10 days or for such time as the workplace is closed. Workers of a closed workplace shall not work in any other workplace during their period of self-isolation. Outbreak-specific testing direction will be provided by the VCHU for workers impacted in a closure. All of these above mentioned key points that are in the Section 22 order as well as in the letter of instruction is not new. It's already there. It helps to set up and clarifies the expectation from the employer to make sure that all of these measures are in place to ensure the safety and well-being of the employees and the public who are accessing it. All support for workplace-specific guidance can be found on our website, www.wechu.org. Thank you.
We'll now take questions from the media. Today we'll start with the Windsor Star.
Yes, good morning, Doctor. Good morning, Teresa. Doctor, about this new order, how helpful will this order be now that outbreaks seem to be tapering off? Is it not a bit late for this kind of clarity?
No, it's not. I think it is important that we know that what to expect from the employees, and as things are getting better, that's the time when people start to lose their guard and people start to get more relaxed in terms of what they're doing. So by reinforcing these orders, it basically helps to make sure that we are constantly evaluating our practices in place and ensuring that everything is happening in the right way. we didn't experience the third wave like many other regions, so we didn't feel that we are in that situation where we need to make it explicitly clear. We already closed some of these workplaces, either voluntarily and sometimes in rare situation involuntarily, to contain the outbreak, to protect the public. We never got into that situation, and I truly hope that we won't be in that situation where we'll be forced to close a workplace, and all the things will be followed. So making sure that the expectation is clear, especially from a reporting perspective, that is really, really important, that we are aware of what the cases are, and the employers are aware about their obligation to report and notify of all these cases. So I feel that it is something to prevent, because obviously when cases are spreading, it's there's limited opportunity. Businesses were not as open as it is right now, especially some of the high risk settings. So I think the timing is right to make sure that we have the clarity and the expectations clearly laid out.
Thank you.
Any questions from AM 800?
Teresa, just going back to the vaccine rollout, sorry, I'm not sure if it's just my end, but you're cutting out while you're speaking. So if someone received Pfizer, for example, and they go to one of the mass vaccination clinics, they could be getting Moderna. Is that what you stated?
Yes, beginning Wednesday for sure. Right now we're Monday and Tuesday seem to be okay, but beginning Wednesday, the residents will receive whichever vaccine we have, and it is Moderna. It will be Moderna.
Will that be stated on the website prior to an individual booking their vaccine appointment, or will they be told at the site?
So we updated our booking site on the weekend to just say that based on the interchangeability of vaccines, that it could be either Moderna or Pfizer, and that you will have your, consent will be reaffirmed or obtained at the time of vaccination. So the vaccinator will also obtain the consent at that time, and it'll be specific to whatever's being offered at the clinic, whether it be Moderna or Pfizer. But they will not know booking into the system what vaccine they're getting, other than knowing that it will be an mRNA vaccine and either Moderna or Pfizer based on availability.
And I know Dr. Ahmed mentioned in his remarks, but obviously you're hoping that individuals don't pass up on this if once their appointment is booked, either like you said, Moderna or Pfizer, to make sure you get your second dose.
Exactly. They're the same, vaccine, mRNA vaccines. So either one will do the job. So we do want people to continue to receive their second doses. Get your first dose if you haven't already. Our first dose uptake's a little lower than the provincial average, so we'd like to increase that as well. But we're doing a good job with the second doses, and people just continue to get, come to the vaccine sites, pharmacies, primary care providers, and get your first or second doses. No matter which mRNA vaccine, it won't matter.
And finally, I noticed on Saturday there was a slight, I'm not sure crash is the right word, but the website went down. Do you know what the response was like? It looks like a lot of people signed on at 8 in the morning on Saturday for their second dose. Do you have numbers on how many people signed up over the weekend?
I don't have the numbers about the sign up, but I do know that our there was an issue on the weekend, and we had a waiting list of people, and our call center called them back. But I don't know how many people have booked. I know we're booking into, I think it's the 28th now. And again, we know the 28th that the ministry is talking about opening up eligibility further. So we're, moving along and filling all of these spaces. So we want that to continue.
Thank you.
Any questions from CTV?
We know at 10 o'clock we're going to be getting more information regarding border restrictions. there are word that the vaccine passport will now be implemented for Canadians coming back into the border. Just your thoughts so far?
So I think it's the reality that things will start to open up, people will travel, and the only issue is how everything is being done in a safe manner. And recognizing that at the beginning, I think that's what I heard, is it will be for people who are fully vaccinated. So definitely something that is critical. We do not want anyone to travel and potentially expose themselves or anyone else at risk. When it comes to even easing off some of these restrictions, I think it's also important to know how it will impact the general public. Would it be open for people who are traveling regardless of where they want, or would there still be some restrictions in terms of which countries or which places where there's a high incidence or high prevalence of COVID-19 cases and ongoing transmission are happening, or would it be a free for all? So I think those are the question that I have, and I'll be looking at the details of what it means for the people, and then we'll potentially look at our local risk assessment and how it will impact our community.
How do you feel? Like, how comfortable do you feel when it comes to visitors and people out of country coming over? I know you're going to be looking at it, but like you said, people from certain countries, would you like to see certain restrictions, or do you feel, listen, if you've been fully vaccinated, welcome to Canada?
Well, I think at this time we are seeing the benefit of the vaccination and how it is helping to prevent the ongoing transmission of the disease. And in the future, obviously, we will be in a position where travel will happen. So it's not that it will never happen. I think the real question is the prevalence of COVID-19 in specific parts of the world, and ongoing transmission, high prevalence, it leads to new variants, new risk for the people. So I think I in isolation, Windsor-Essex, I think it will be okay. But any kind of new introduction, any kind of influx of people, it would increase the risk. And again, depending on how lax the border is, the risk could be high, the risk could be low. And understanding that we cannot keep the border closed forever, there will be certain level of openness, but I don't think that it would be appropriate to open it for all. We just have to be very careful. We just have to be measured and careful in how we increase or add more risk to our local community.
Thank you.
Any questions from CBC?
Yes, good morning. Around how many doses of Pfizer do we have right now? And do you have any concern about getting enough of that vaccine to meet the demand for first doses for those who are 12 to 17 and are only eligible for that vaccine right now?
So we are monitoring all of our vaccine supply, and as you know, we are working closely with Windsor Regional Hospital, who also delivers quite a bit of vaccine through our mass vaccination clinics. And regarding the Pfizer, we have worked out how many people 12 to 17 years of age that are booked right now that require the Pfizer. So that has been set aside to ensure that that age group receives Pfizer. So right now, Pfizer is the only one approved for that age group, and that could change based on trials with Moderna. But right now, so we have set that aside. We will run out of Pfizer, and I think I mentioned this about a week ago that it is likely we'll have to move to Moderna, whatever vaccine we have, mRNA vaccine. But right now, you're asking exactly about the dose of Pfizer, and I just know we don't have enough to move us past. At the end of day Tuesday, we will have used up all of our Pfizer. So beginning Wednesday, Moderna will be the primary vaccine you'll see at clinics, pending any more shipments of Pfizer, which are expected. and we'll just interchange them as we can. But people won't have that ability to, to actually have a pathway that will match their first dose. They'll get whatever we have in stock and on hand and across all of our vaccination sites.
Thank you.
Any questions from CFTV?
Yes, I have one. Thank you. When you're talking about people under 18, like between 12 and 18, when they go in to get their second dose, does the time frame between the two doses matter? Like, is there better immunity if you wait a little longer, or do you suggest that we book for our kids right away?
So, so right now the provincial direction is at least 8 weeks for the first and the second dose, given the direction based on the supply issues. The product monograph, obviously, depending on the vaccine, is 21 to 28 days. We know that there are some good data that basically endorses that if the second dose is delayed, there's more benefit to it. And again, all of these is subject to the ongoing risk. What we hope that we should be able to give the 2 doses of the vaccine to all children in our area before they go back to school in fall. So that's our hope, but if the supply increase, there may be an opportunity for children to book early, maybe 8 weeks or even earlier, depending on the supply issues. Right now, the direction is anyone who has received the vaccine, their second dose will be should be offered to them after 8 weeks, and hopefully we will have enough vaccine to meet that target, or even vaccinate them early. I would generally recommend for anyone who's looking to get from first dose to second dose, it's if the vaccine is available, yes, please go for it. But delaying the vaccine, it is not it doesn't put you at any kind of disadvantage. In fact, it helps to further boost the effect of the vaccine, the first dose that you have received. If you are delaying it for 5, 6, or 8 weeks, up to 8 weeks, 8 weeks could be an optimal time to get the vaccine.
Okay, and if let's say you get this vaccine, you've got the first one in for the kids between 12 and 18, they've got their first dose, and all of a sudden you run out of vaccine. If they're waiting longer than the 8 weeks or the 12 weeks due to delay of vaccine, does that still protect them? That first shot still protect them until they're waiting, or is there a specific time frame for them to get it?
Yeah, so ideally we would want them to give the vaccine, as we have initially indicated, up to 16 weeks is the timeline that we said. There are some individuals who need a shorter interval, especially individuals who have some kind of immune response or delayed immune response, or have low immunity. Those are separate individuals, but for everyone else, I even up to 16 weeks should be okay. Based on the projection and the vaccine supply, I'm not anticipating that this would be a situation that we won't have vaccines for them. I truly feel that we will have a vaccine for everyone, even before the end of summer. So I'm not anticipating that anyone will be left just because of waiting, and they will get the vaccine. But if the supply is there, we want to make sure that people are fully protected, to make sure that we are preventing any risk to in our community. And by the time when even I think we're anticipating in a week or two, we will hear from Moderna that whether it would be approved in the 12 to 17 years of age or not. The soon it comes out, then we won't have any concerns specific to the 12 to 18 years of age. But despite that, we will make sure that anyone who lives in Windsor and Essex County should be offered a vaccine that is available to them, that they are eligible to receive. We will be offering them the vaccine as soon as possible.
Okay, thank you very much.
Any questions from Blackburn?
Yes, good morning. I know people use, this whole new comments. We've talked about the interchangeability. If someone chooses, they go and didn't hear this, refused the dose. What happens to those doses? Are you concerned that there'll be more wait if people start getting the dose after the original one?
Well, you're right. So if they refuse, then obviously we have an appointment that is not filled, and we'll have a vaccine that is not taken, and the people on site will need to plan it out, that how much extra vaccine that they have, how they want to give it out, and could potentially result in wastage as well. We certainly hope that doesn't happen, because all of these interchangeability messages has been coming out, and I know choice is something different, and let's just separate the choice from the scientific recommendations or scientific validity of the interchangeability. Nowhere in any of the scientific bodies in Canada has questioned or said not to mix and match these vaccines. We have always said along right from the beginning, get the first vaccine available. Vaccine interchangeability is not an issue, even for the two different types of vaccine that we talked about, AstraZeneca and mRNA. We know based on the clinical data, it doesn't impact the immunity, and in fact, in some cases, it can help to boost the immunity. With the two mRNA vaccine, there is no concerns about mixing and matching. So people need to be absolutely clear about this scientific recommendation based on all the experts, based on all these people. Do not listen to some of the other misinformation when people are basically more concerned about the choice. Choice is always good when you have a variety of options available to you. But at what cost? The cost is if we continue to delay the vaccine, we will be in a position where we may see some resurgence of these diseases. There are countries in the world who do not have vaccines at all, who do not even have access to an mRNA vaccine. They are looking for some lower quality vaccine that are either not even approved by WHO. We are lucky. We have plenty of vaccines available to us right now, and we should take it. We should not wait and just because I want something different and put anyone at risk. So let's just be very clear. The scientific recommendation, scientific direction is very clear that these both vaccines are equally safe and equally effective in preventing COVID-19 transmission for you. So please listen to that part. Everything else is all about logistics and all about how people should make their choices. I would encourage everyone to get the vaccine that's available to them.
And I know this is not what you're recommending, but if someone says, I'm going to wait till we have Pfizer on hand, is it expected that we will have Pfizer? Will they be able to, know where and when they'll be able to get a Pfizer vaccine? Or, will they have the choice at some point? Do we expect more Pfizer in the community?
So we know right now there is a reduction in the supply of Pfizer. So we know that. And what happens in the future, we don't know. There has always been some supply challenges throughout this vaccine rollout. So we don't know when it becomes available. But as Teresa has mentioned, even if people are looking to book an appointment, they had to wait for 10, 12 days before they can get the vaccine now. It is because of the so many eligibilities that we are seeing in the community. If you're not getting the vaccine, then you'll be obviously asked to rebook your appointment. But when you're rebooking the appointment, there is still no guarantee that what would happen at that time. So if someone wants to take that risk, again, I can't force them to make that choice, but I would definitely strongly advise against that, just because you want something, you want to put yourself at risk and others at risk. That's your option. That will always be your option, because you will not be forced to receive any of these vaccines. It will be available to you. You will have the option. And again, and through you and through this session, I also want to convey this message as when you're talking to our staff, our call centers and other places, please be respectful. This is something that we are telling you that these are your options. If you don't like that option, wait for it or do whatever you need. That doesn't give you any option, any opportunity to be disrespectful or to say anything that is not professional to our staff or to anyone else. Get the first vaccine available. It's safe, it's equally effective. If you want to wait for it, no one is stopping you to do that, but there'll still be no guarantee that you will get the vaccine that you're looking for.
And last question on this, are pharmacies getting different supply? Are they also mostly getting Moderna at this point, and the AstraZeneca? What's the supply route for the pharmacies at this point?
So given the supply challenges, obviously most of the supply is coming to public health, and to ensure that our mass vaccination clinics, because we have already made many of the booking, so it is coming to us, but I don't know if Teresa wants to add on that, but majority of the supply is coming to us and will be utilized in our mass vaccination site, and the supply for the vaccine at the pharmacies and other places will be reduced as well. So Teresa, I don't know if you want to add.
Yeah, so based on the Pfizer delay, we'll have to look at everything. And this was just, communicated to us on the weekend. So typically, pharmacies have had Moderna, Pfizer, and AstraZeneca. So all of that will shift and change a little bit, but people will have to, contact their pharmacies. We do have the list on our website, and the province has a good list on their website. But they have had Pfizer in the past, but they're going to be in the same position we are. They won't be able to guarantee a specific type based on vaccine supply.
Any additional questions from the Windsor Star?
Yes, what does our current vaccine supply look like? I know last week was an exceptional circumstance with around 50,000 doses arriving, but what are you expecting this week in the future?
So for this week is June 21st. Due to the delay, I'd have to look at all of that again. Really, we just have been trying to work with what we have on hand to get us through the next few days until the shipment arrives, and we also are awaiting more Moderna. So I have to look at that. I know that we have booked our clinics to whatever have allocated the vaccines to our clinics. So whatever we're booked up to is what we can guarantee at this time. There definitely has been a shift from Pfizer to Moderna, and I don't know exactly what Moderna, what we have for the mass vaccination sites, because in addition, we're using Moderna for our mobile sites and for primary care providers. And we do have Moderna being used right now in Leamington to give second doses for the agri-farm workers. So the Moderna is being used up as well. So the supply, we're monitoring it. So I don't have that exact answer based on lots of vaccine going out. I know we're very tight. We're very tight.
Are you concerned about the future supply? Because now so many more people are available or eligible for their second doses. Do you expect that once this current issue is resolved, there will be a significant supply of even Moderna vaccine to Windsor-Essex?
Well, we have been told by the province that Moderna will, there will be a significant supply coming to our area, and that's throughout the whole province. So what we're experiencing, the challenges with Pfizer and with the vaccine supply will be felt across the province. So I think everyone is trying to make the best decisions for their area, but we expect that we're going to have lots of Moderna and it won't be an issue, and that's why we want people to know what's ahead. We do have just Monday and Tuesday, knowing that whatever people we're booking at that time. We're, you know, that they can expect that, but come Wednesday, we are going with the supply that we have on hand, and it will be Moderna.
Okay, and separately, back to you, Doctor. Will the new order be posted to the health unit's website so we can read through it?
Yes, the plan is that this order will be posted later sometime today, and with the implementation on starting at 12:01 on Friday, June 24th, I believe, or whatever the date is.
Thank you.
Any, pardon me, any additional questions from AM800?
Teresa, is this your last week or are you working next week as well?
I'm working right up to the 30th, so I think it's not the last week quite yet, but the last full week.
How are you feeling heading into your last couple of weeks here?
I feel like nothing's changed. We've had a very busy weekend, and I continue to put in a lot of hours. So I think I'm going to sleep on July 1st. I think that's what's in my near future.
Thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from CFTV?
No, thank you.
Any additional questions from Blackburn?
Thank you.
Thank you, everyone. See you on Wednesday.